Hi everyone, I'm Ben Abramowitz, and I'm going to be speaking with you all about Self-Care 101, Mastering the Eye Drop. So just a couple things to keep in mind. First, make sure to wash your hands before you put in your eye drops to make sure you don't work with any contaminated surface. If you have any crusting around your eyes, which can be common in the morning, you first want to clean your eyelashes with a warm washcloth to get that crust out of the way and make it easier to put the drops in. Always check the label on the eye drop to ensure that it's the correct drop that you're putting in, and also you're putting it in the correct eye as well. So moving forward, after removing the eye drop cap, you can lay it on its side to avoid contaminating the inner surface of the cap as well. These drops may be used for 30 days or even longer, and so you want to make sure there aren't bacteria or other contaminants getting inside the bottle that can grow over time. And you also want to be careful to not touch the end of the eye drop with your hand or any other object. You want to try to avoid your eyelashes, your eyelid, and the surface of your eye, obviously, as well. If the tip of the bottle does become contaminated, you don't need to throw it out, though. You can wipe it clean with a sterile cloth, or you can even use an alcohol pad and then let it dry over the next minute or so, and that should clean the tip, and you can safely use it again. As far as technique, safe technique putting your eye drops in, you want to start with putting the back of your thumb against your forehead, as shown in the diagram below. And then you want to be careful to avoid pointing your fingernails towards your eye to avoid an inadvertent scratch to the eye. Especially if you have very long fingernails, you need to be very careful. And then you want to tilt your head backwards and look at a point on the ceiling. And you want to have both eyes open to help avoid blinking, although if it's easier for you, sometimes you can do what one of my mentors called the one-eyed monster and look up with just one eye open as well. But keeping both eyes open can help to focus on a point on the ceiling. Then you want to gently pull down on the lower eyelid to create a pocket for the drop, as seen here. And then you can position the tip of the bottle so that it does not touch the eye, the eyelashes, or the eyelid, and you want to get the drop into that pocket. Then you can gently squeeze the bottle to allow one drop to exit. And then make sure to not squeeze your eyes tight after you put the drop in, because that might just squeeze it right out. You want to gently and slowly close your eyes. Then you can also blot off any excess liquid with a tissue. At this point, after you put the drop in with your eyes closed, you can gently apply pressure to the inner corner of the eye where it meets your nose for at least 30 seconds or so, and that helps to keep the medication on your eye for a longer period of time and help its absorption into the eye. You can apply that pressure for even another good 2 to 3 minutes if you'd like, and that helps to keep the medication from being absorbed into the rest of your body and may help to produce fewer systemic side effects throughout the rest of your body. You may notice you get side effects from some of these medications. They are highly concentrated when they're in the eye drop, and sometimes you might notice fatigue, lower blood pressure, and this punctal occlusion technique can help to prevent it from getting into the rest of your body and only staying on the surface of the eye. And this is a diagram of the Lacrimal apparatus. As Dr. Lee was mentioning, there's different flow within the eye and then on the surface of the eye. This lacrimal apparatus deals with flow on the surface of the eye. Here you have the lacrimal gland, which produces some of the tears that coat the surface of the eye. And this is on the upper outer portion under the eyelid. And then the tears coat on the surface of the eye, and eye drops drain through this same mechanism. You have a hole here called a punctum on the upper and the lower eyelids, and then they go through drainage channels that often come together and then go into the lacrimal sac. This then drains down underneath the bone and then into the lower portion of your nose, which will eventually go into your throat. So it's not uncommon to notice that you're tasting your eye drops because that's the normal pathway for them to go. If you do apply that punctal occlusion technique, however, that can help prevent it from going down through this drainage pathway and absorb more into the eye, and you may notice that tastes less as well. If you're having difficulty with your eye drops, you can try this other method. With your head turned to the side or lying to the side, you can close your eyes and then place a drop in the inner corner of your eyelid the side closest to the bridge of your nose. And then by opening your eyes slowly, you can feel the drop fall right into your eye. Some people note that they have trouble with eye ointment, and that is administered in a similar manner to the eye drops by creating that pocket between the eyeball and the eyelid on the lower eyelid and gently moving the lower eyelid down. Again, you want to be careful with eye ointment not to touch the tip to the eye, the lid, or the lashes, and you can just gently squeeze the ointment into that pocket, and then when you blink, the ointment will coat over the surface of the eye. Some other things to keep in mind: you do not want to leave your eye drops in direct sunlight, as it may cause a chemical reaction inside the bottle and change the content of your medication. Most of your eye drops do not need to be refrigerated, however, some do, so you may want to consult with your pharmacist to ensure that your drops are being stored at the correct temperature. Some patients find it helpful, however, to refrigerate all their eye drops. Sometimes the cold and wet feeling of a cold drop lets you know that it went into the eye better, and sometimes it can also increase tolerability as well if the medication is cool rather than at room temperature. You also want to frequently check the expiration date and make sure you're not administering expired drops. If you've never put in drops before and it's your first time, you want to make sure to ask a nurse, a technician, or your doctor to make sure you're using a proper technique. You'd be amazed to see how many patients we see who've had glaucoma for years with uncontrolled pressures, and we ask them to show us how they put their drops in, and they're putting it on their head or they're putting it in their mouth, and you're amazed sometimes. If you have other people with you at home, sometimes it can be helpful to ask for help. It can be easier sometimes for another person to put in your drop for you. And another one of my mentors encouraged all his patients, if they had someone at home to help them put in drops, not only does it help ensure that it's getting in and in the right place, but it's someone also to remind you that you're getting the drops in on a regular schedule and that you're not the only one solely responsible for it. And you may also find it easier to put in drops in front of a mirror or lying flat on your back so you can get a better angle or get a look as you're putting the drop in. And you also want to make sure you understand why you're taking each of your drops and what possible side effects may occur with each one. If you have any issues with your drops, you want to let your doctor know, and so they can guide you appropriately. But you never want to start, resume, or stop any of your drops without your doctor's guidance. If you have any issues, talk to us. We're happy to help you, and don't start or stop these on your own so we can help make sure what's going on. Some other things to keep in mind with contact lenses: you don't want to put in your drops with contact lenses on, although sometimes it's okay, but you want to make sure your doctor is aware of this and you're putting them in with contact lenses in an appropriate manner. You want to give yourself about 5 minutes or so between each drop. If you do it quicker than that, you might wash one medication out with the next one and reduce the effectiveness. If you're using eye ointment and drops, you want to make sure to put in the eye drops first. Otherwise, the ointment may serve as a barrier that may prevent further drops from being as effective. And another thing to keep in mind is that each drop is several times larger than the amount of fluid that the eye surface can handle. So it's never necessary to administer more than one drop at a single time. And it's also not uncommon to feel like you have a little liquid coming down your face. That doesn't mean you didn't get the drop in your eye. That could just be the excess coming off the surface of the eye. Some other things is you want to make sure you have adequate lighting so you can see the bottle easily and where you're bringing the bottle. And if you're having trouble with your eye drops, you can pick up a bottle of artificial tears or ask your doctor for a sample. And you can practice with those and make sure you have something easy to practice with and you're not wasting medication putting the drops in an ineffective manner. If you find that you have tremors or your hands are shaking, you can try to approach your eye from the side to allow your hand to rest on the side of your face. Some people also advocate using a 1 or 2 pound wrist weight. That can also help decrease mild shaking as well. If you experience any difficulty holding onto the bottle or feel that it is too small, you can also wrap it in a paper towel, and that may provide some more bulk, and you might find it easier to grip. This is an example of an eye assist device. These can be picked up over the counter at a lot of local pharmacies, where you can put your eye drop in, and then there's some leaflets on the side. There's also a cup to make sure it does not touch the surface of the eye. You also want to make sure you don't forget your eye drops. If they don't get in, they're not going to be effective. You want to try to use a reminder system that works well for you. You want to try to take your eye drops with other medications or at a time of day when it helps to cue yourself. This is just a generic eye drop chart. There's plenty of examples you can find online or at your doctor's office to help make sure you keep track of your medications. We understand they can get very complicated sometimes, but we're happy to help you find a system that works for you. This is another assistive device to help remind you. It's a bottle with a timer on it that you can put your drops in, and it can help remind you when it's time for your drop to be due. Also with technology today, there's plenty of smartphone applications and other electronic devices that can remind you to take your drops. This guy's late for his Ocuvite pill, but technology is great, and use it to your advantage to help make sure you're getting your drops in on time and you're not forgetting your doses. Thank you for your attention.